During my initial visit with patients, particularly those who are estrogen receptor positive or those who have ductal carcinoma in situ, I generally mention that we may well be ordering the Oncotype DX test as part of the overall data gathering process for the individual patient's case. And the patients will often ask me, well, gee, Dr. Harness, when are you going to order that test? Well, the beauty of the Oncotype DX test is we do it off of what's called preserved formalin-fixed tissue, meaning that after a core biopsy is done, the little core biopsies are put in formalin and fixed, or when a cancerous lump is removed from the breast, the same thing happens. It's fixed in formalin, and the same is true for in situ breast cancer. That gives us tremendous flexibility on when we may order the test. Recently, I've been ordering the test off of the core biopsies in those patients that were considering upfront anti-hormone therapy called neoadjuvant therapy. In my patients who are lymph node negative, I order it almost universally in all patients because it gives us such important information and potentially the ability to avoid chemotherapy, have information about what the chances of recurrence are, et cetera, et cetera. And most recently, with my ductal carcinoma in situ patients, the Oncotype test is very helpful in knowing whether a patient is going to benefit from adjuvant radiation therapy. So the beauty of the Oncotype DX test is we can order it after the core biopsies, after the primary surgery, perhaps just before seeing the medical oncologist. As a full-time breast surgeon, I generally order the test before the patient sees the medical oncologist so that we don't delay any needed future therapies. Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.